So, total knee replacement in a patient, 1-stage or 2-stage. I didn't really think there was any debate on this. And looking at the evidence, there is no evidence. There's lots about 1-stage or 2-stage revisions, but not much on, or anything really, on if you've got pre-existing metalwork. So this is just anecdote. It's not scientific, this talk. And the concerns that all of us have around knee arthroplasty is early infection, which is deep, or wound dehiscence. So here's a patient, and it's one of my own patients, so you feel free to criticize. Quite a significant fracture, treated like this. Some years later, these are the wounds. So I do the Adelaide approach for the lateral sides precisely because I want to be able to do a knee replacement. So if you see the one on the right, I go up and then straight 90 degrees across, and he needed a separate medial one. So the skin bridge between the two is small. It's less than 7 centimeters, and insole says make it 7 centimeters, and a few years down the line, it doesn't matter. So, but I'm still nervous. And so if the wound is going to break down, I don't want a knee replacement underneath when the wound breaks down. So my argument is that, and the plastic surgeons are a lot happier and a lot friendly if they're more friendly if there's a complication. If I've taken the metalwork out, and then if there's a problem, then I can involve my plastic surgeons and colleagues to resurface the tibia, and then I can go in and do the knee replacement. One word of warning, plastic surgeons aren't knee surgeons. One of my greatest regrets is that I did this and they needed soft tissue resurfacing, so they got a free flap, and then at the time of when doing it was a complex knee replacement, he said, oh, I'll get the exposure. I had some other things to do, so I went off. I came back, and they'd stripped everything, including the patella tendon, off to give me a nice soft tissue-free proximal tibia. And that patient didn't do well, ended up with an amputation after a few years of trying. So it's my one and only time that I've left a patient, and one and only time that I've suffered. And so don't do that. So there's the knee, there's the incisions, and what you don't want to do is have something like this with a knee replacement underneath. So if I'm worried, I discuss with my plastic colleagues beforehand, and they're always again happier. I do a 2-stage procedure, I remove the metalwork, and I take bone biopsies all the time when I take, and then send that off. And then if there's a problem, I know, and we can deal with it, and I play it safe. Thank you very much.